Ellerin, Director of Infectious Diseases at South Shore Health, to talk, of course, about COVID-19. Doctor, thanks for being with us. We always appreciate it. Today, the governor explained everything that the state has done since March to reduce infection rates, increase testing. He did say cases are on the rise, but he's not calling this a surge. When you look at the state data, do you believe that we're at the start of a surge?
Marie, I do think that we're starting to see an increase. Over the summer, when you looked at new patients testing positive, we were under 1%. Now we're between 3 and 4%. So it's really 4 to 5 times increase since the summer. It's getting colder. We're moving indoors. I'm worried that we're seeing an increase, and it may be sustained.
Let's talk about transmission. The CDC published an article about an outbreak this summer that impacted a dozen family members who live in 4 different states. That outbreak started with a child. Can you expand on that? Because I know a lot of people live in this very similar type of a scenario.
Yeah, Ed, this is really important. So what they looked at was 5 households from 4 different states. They stayed together for 3 weeks indoors, so a lot of close contact. And what they found out was it was a child that was 13 years old that actually led to 11 additional cases. And what happened was this child, a few days before he left for this vacation, he actually was part of an event where there were positive cases. So he was a close contact. He had the rapid test. That was negative. Then 2 days later, he had mild nasal congestion. That was his only symptom. And yet he likely spread it to all of these different family members. We learned a few things about this outbreak. The first is that children can be vectors for transmission, even with mild symptoms. That's very important. Next, a negative rapid antigen test, because it's less sensitive. If you're in a high-risk exposure, you probably want to repeat that. Additionally, remember, regardless of the test result, if you are close to a positive case, you need to quarantine for 14 days, whether you test positive or negative. Also, 6 family members that also came to visit but never went into the house and were just outside, they were kept their distancing but weren't wearing masks. None of them tested positive. The importance of physical distancing and outdoor exposure. So, I think that SARS can spread efficiently indoors. If you can't mask, distance, then you really want to avoid these gatherings.
COVID. Okay, excellent. Dr. Todd Ellerin from South Shore Health. Thank you so much. That was fascinating. So much more to talk to you about, but we've got to go.
Thanks, Doc. Be well.
Thanks.